Hi, this is Alexandra Ellis of aewellness, and I have an ankle joint mobilization for you today. If you have ever sprained your ankles or you are a human, because many of us have super tight ankles, this is a great technique that you can do to maintain the full range of motion for your ankles. This will allow you to do a number of things from jumping, walking, running, or deep squatting if that's what you're looking to achieve. To do it, you'll need a chair and a pair of toted therapy balls. These are the Yoga Tune Up Therapy Ball Plus, and I like them best for this rather than some other type of therapy ball in a sock for this reason. This tote has open cells, which will allow the grippiness of the therapy balls to grab a hold to the top of the ankle to maximize the amount of fascial shear or stretch that you're able to get. The setup is pretty simple. The therapy balls are going to go over the top of your ankle just like an ankle strap would go. So that's where it lands on your foot. And you want to put the therapy balls on the chair in a way so that your foot hangs off of the seat and your shin is on the chair seat. Now, depending on your proportions, this may or may not work. You might need a bench or some other sitting arrangement to help facilitate this. Ideally, I'd have this back leg forward, but I wanted you to be able to see where the therapy balls go so that you know what's happening. Once you have the therapy balls docked in place, you sit down to apply as much pressure as you can tolerate comfortably. If this isn't a possibility, this much knee flexion, get a block, get a towel, just get something to pad up so that there is some pressure on the ankle. What's happening here is that the therapy balls are docking onto your lateral ankle bones and helping to glide them backwards as the weight of our body or the weight of your body helps to move your heel bone and the talus and the ankle down towards the ground. So we get some mobilization of the bones of the ankle joint. What you'll do now is, in addition to just hanging out, and I know your ankle is talking to you now, is that you'll try to plantar flex and dorsiflex, or point your toes and then flex the ankle. And the grippiness I talked about through the open cells of the therapy balls, they will be able to grab onto your skin and the fascial layers underneath. On the top of the ankle, there's this really beautiful weaving of dense connective tissue called the retinaculum. And the retinaculum helps to hold the tendons of your ankle extensors and toe extensors in place so that you are able to manipulate and move the ankle and toes. Sometimes things get a little gunked up in there, so this helps to ungunk all of that. In addition to pointing and flexing, you can also try to wag your foot from side to side. So I'm now trying to move the foot towards the big toe and then over towards the pinky toe. So a little bit of inversion, eversion, but in a weird angle. And then you can also draw circles and just try to articulate the foot and ankle through as much range of motion as you can. Now, if at any moment your foot goes to sleep, please come out of this and just build up to a place where you can tolerate. I'd say about 2 minutes per side will be good here to give you full ankle range of motion. When you come out of it, you will definitely have some awesome lizard printing of the tote onto the surface of your ankle, but you will definitely be able to feel the difference. For sure, there's a lot more range of motion in the ankle we just did compared to the other one. So give that a try on the second side. Again, about 2 minutes per side with the therapy balls over the top of the foot like an ankle strap so that each of the therapy balls can dock its way onto your lateral ankle bones to help with the joint mobilization. If you want to learn more about maximizing your mobility to live pain-free in your body, be sure you check out my website at aewellness.com and stay tuned here for more videos.